my God. Oh, hello, Mr. Gordon.
Hey.
Here, I'll shake this hand. Shake this hand.
Hey.
All right.
Chris is presenting to a physical therapy clinic following a fall. He is a 67-year-old male, suddenly developing left leg weakness and left alien hand syndrome.
Hello, how are you doing today? Let's have a seat.
Okay.
Okay. Let's have a seat. We'll sit down outside. So what brings you to my clinic today?
I'm fine.
Oh,
Yeah, this morning we were having breakfast and he went to stand up and then all of a sudden he just fell over and I panicked and I called 911 and was able to stand up on his left side.
oh wow.
Nah, I'm okay.
Okay, well, before we start, I'm gonna run a couple of tests on you just to see what's really going on.
Okay.
Okay, so after our tests, I can see that your vitals are fine. You don't have a fever. You do have some hypertension. Does he have history of hypertension?
Yeah, he's always had hypertension.
Okay.
And he's been smoking a pack of cigarettes a day for the last
Wow.
40 years.
Oh.
I'm fine.
Okay, well, I'm gonna believe your wife, so yeah. All right.
You would.
And then everything's fine with your neck, your lungs seem clear, your heartbeat is regular, your abdomen is soft. And I do see that you have some scrapes and abrasions on your left side, on your left arm. Remember doing that? Oh, okay. Do you know where we're at right now?
Yeah, of course.
Where are we?
San Marcos.
Okay, what's your name?
Chris.
Okay, very good. Very
Can I smoke in here?
Unfortunately, you can't.
Chris's therapist, Kiana, ran a physical exam on him and found his vital signs to be normal, other than the mentioned hypertension. His neck, lungs, heart, and abdomen were found to be completely normal as well. The only abnormality were the abrasions present on his left arm and leg. Then she ran a neurological exam, which she's going to go over the findings now.
Neurological part of the exam, I can see from my notes here that your cranial nerves are normal, except there's some minimal decreased left nasolabial fold. And are you okay? Okay. Okay. And then for the motor part of the exam, you have all your power, 5 out of 5 throughout. But on your left side, it's a little weaker.
I don't know what you're talking about.
Another example, clearly, that our patient was unaware of his fall and unaware of his deficits.
From the tests, I see that your results are for your reflexes, that your reflexes were actually affected, especially in your upper extremity. And in your right lower extremity, everything was normal, but on your left, it was affected. But in both...
I'm normal.
Okay.
All over.
Oh, I see. Okay. And then in your both of your left and your right Achilles tendons, there was no reflex at all.
What?
Yeah. And then also from the sensory part of the exam, based on my results, it says that there was an inconsistent decreased response to a pinprick. Do you remember me doing that to you? There was no response on your left side.
What do you mean on my left side?
On your left arm.
So to wrap it all up, Chris's current condition worsened so that 2 days after admission, he had 0 out of 5 strength in both the left leg and arm. He also had extinction on the left side to double simultaneous tactile stimulation. 1 month later, he had recovered 3 out of 5 strength in the left arm, but continued to have 0 out of 5 strength in the left leg. Interestingly, he complained that his left arm was, quote, out of control. His left arm would occasionally grab onto things without him being aware of it, and then he would have to use his right arm to release its grasp. He could not localize his left arm in space and had difficulty using his left hand to perform voluntary activities with marked motor impersistence. As you're going to see in the next video, he is asked to do a task with a distraction and then without a distraction. With a distraction, notice how he performs the activity. He is much more effective.
Do you mind grabbing this pen for me?
Yeah.
And then do you mind looking at your wife and then folding your paper?
So the key symptoms and signs in this case are profound weakness of the left leg with mild weakness of the left arm and face, mild dysarthria, left leg hyperreflexia, and Babinski's sign. I know I already mentioned in earlier parts of this video. The left grasp reflex and motor imprecision were a big sign, often having to be distracted to use the left hand a little bit more effectively. The left arm was described as out of control, and Chris was even unaware of that left side weakness and abrasion when he fell, as well as decreased response to the pinprick, as well as any tactile sensation on the left. So what could have caused this? It could have been an upper motor neuron type weakness of the left leg caused by a lesion either in the right primary motor cortex leg area or a left thoracolumnar spinal cord. However, since there's also mild dysarthria and some left face and arm weakness, there had to have been involvement of some of the fibers for the face and arm, ruling out a spinal cord lesion. Therefore, summing up what the most likely clinical localization is, it's the right primary motor cortex foot area, also including the supplementary motor area and other adjacent regions of the right frontal or parietal lobe, so not a spinal issue. So now to wrap it all up, what is the most likely diagnosis? Well, given the sudden onset of the deficits, together with the patient's age, history of hypertension, smoking, and peripheral vascular disease, the most likely diagnosis has to be a stroke. I wanted to also quickly mention a few less likely causes. One of them could be a hemorrhage, and some other could be tumor or infection. However, a tumor or infection is a lot less likely because the deficits did improve over time.